Good morning, everybody. Thank you for joining the weekly LeadingAge Virginia call. We have a packed agenda as always. And so I'm wondering if Dana Parsons, you are here yet? She was having some computer issues. It's one of those weeks. Okay. Annie Rhodes, are you on yet?
I'm here.
Hey, Annie, thank you so much for being here with us. It's Melissa. We're so excited to reconnect with you. I just want to remind our members that Annie was an intern for us when she was at Department of Gerontology, and so we're so happy to have her on our call to reconnect with our members and share everything about Project Echo. So, Annie, the floor is yours.
Okay, hello everybody. Good morning. I am coming to you all today because Virginia Commonwealth University, the School of Medicine, the Center on Aging, we've all come together and we are now the National Nursing Home COVID-19 Echo Hub for Virginia nursing homes. I'll talk a little bit about Project Echo, but I really want to use my time today to answer questions for members. Basically, Project Echo is a mentoring model, which is supported by AHRQ and Institute for Healthcare Improvement, looking at supporting nursing homes, nursing facilities during this time of COVID-19. What the basic model is that communities which are interested will sign up for the program itself is 16 virtual sessions, an hour each week at the same time. And as a participating community, you need to attend 13 of those sessions. And there'll be lectures from geriatricians and nurse practitioners. There'll be case studies. And we'll talk about treating COVID-19 in the nursing home environment. And at the end, if you complete the module, then through the Provider Relief Fund, you're eligible for $6,000. So that's the short kind of summation of it. There's a lot of information about Project Echo and funding and all the other ways in which it's been applied. But I want to talk about how we're using it right now and getting it started in Virginia. So next slide. So the topics that we're going to be discussing will be PPE, infection control practices, minimizing the spread, COVID-19 testing. This is all over a 16-week curriculum. Again, it's taught by geriatricians from the School of Medicine at VCU and the Center for Advanced Health Management. And then nursing home participants will be invited to submit case studies, things that they're seeing or struggling with, and it'll be discussed in a didactic clinical setting, all, of course, anonymized. The idea is that we will all teach and all learn. Generally, in a cohort, there will be 34 to 36 nursing homes, so it won't just be your community on with the geriatrician. It'll be a whole group that you follow through for the entire the entire 16-week program. And hopefully we all come out being better practitioners and better able to support our residents and our staff in this amazing, horrible time of COVID-19. Next slide, please. So we are currently enrolling right this minute as I speak, but we have a very narrow enrollment window. This is not because I want a narrow enrollment window. This is through the Echo Institute and AHRQ. I think we all know that because of the surge going on all over the country, we are expecting, as bad as it's been in nursing facilities, we are expecting it to get worse. And so AHRQ and the Echo Institute is really pushing us to get enrolled and kick off as quickly as possible. So that means that we need to have communities that are interested in participating enrolled by November 9th. And I know that is a really quick turnaround. We just got approved to be in Echo Hub last week. It's a really quick turnaround for our team as well. But we want to get this opportunity out far and wide and let you know that if you are interested, please get signed up very quickly. If you are a licensed Virginia nursing home, we have room for you in this project. So we have the space for you. You don't need to worry about us filling up and not being able to include you. We wrote the contract to be able to include all 250 plus licensed nursing homes in the state of Virginia. So to be eligible for reimbursement, the $6,000 from the Provider Relief Fund, you have to be a licensed nursing home participating in either Medicare or Medicaid. And you must have 2 staff members attend 13 sessions. It has to be the same 2 staff members throughout the entire course. You can't rotate staff members. A lot of people are sending their DON or administrator and whoever's acting as the infection prevention specialist in the community. That being said, you can also rotate in other staff members. So we are encouraging that if there's a topic that you really want maybe your direct care staff to attend, like we're going to discuss PPE donning and doffing one week, and you want to rotate some, or you want to add some CNAs or LPNs, your floor staff in, they're welcome to attend. But to get that $6,000, it has to be the same 2 people who attend the entire course. And again, the course goes 16 weeks, but you as a community, you only need to attend 13 weeks. So we give you a little bit of leeway because obviously stuff happens. And if survey walks in and it's all hands on deck, I know that you're going to have to miss your echo session that week. But to get your $6,000, those are the basic requirements. Next slide, please. So the link is right there. That's to enroll your community. It's a red cap survey. It's really easy. You can click it and go right there. It's nice if you can have your NPI ready when you click to enroll your community. But if you don't have it, just put in your address and we'll figure out the rest from there. Also, before you go enroll your community, have identified which 2 staff members you want to attend all sessions. And then a member of the ECHO team will let you know what cohort you're going to be assigned to and what time and day we're going to meet. You do have an option when you register your community to pick your preference for time and day for meeting. So I would suggest the more people who sign up and the faster they sign up, the better we can put people in the time slot that works for them. And that is really my next slide. Let me make sure I didn't miss anything. One thing I want to say, we are partnering with the local QIO for Virginia, which I know that sometimes they're called Health Quality Innovators, sometimes they're called Health Quality Innovation Network, sometimes they're called HQIN. They're very involved and supportive of this initiative. I really want to encourage all communities to participate, particularly any community that has been is working with their QIO as either part of the Targeted Infection Quality Improvement Initiative or just signed up for support from HQIN for additional guidance during COVID-19. We really would encourage you, and they would encourage you to enroll in this initiative. Additionally, if you have become a COVID hotspot recently, which I think the cutoff is 30 cases now to make it a hotspot, then this would be an excellent thing to enroll in. But of course, it's open to everybody, and I will take your questions now. I know that there were some in the chat, but I don't know how to read the chat. Here.
That's all right, Annie. I've got it for you. The question that came in is, does the SNF have to be Medicare and Medicaid or either of them?
Either.
Okay, that's
Just
great.
as long, yeah, either. And we are also opening enrollment to it can be either, and we are also opening enrollment. If you are, and I don't know that this is going to apply to anybody on this call or really most facilities, but if you are not participating in Medicare or Medicaid, then you are still welcome to join. You're just not, and you're a nursing home, you're just not going to be eligible for the reimbursement. But to be eligible for the reimbursement, it can be Medicare or Medicaid, either or.
Great. And I just wanted to give a little testimonial. I spoke to my colleague in Connecticut, Kelly Papa, who's at Doncaster community, and they launched last week. They were the first state to launch their Project Echo, and incredible just collegiality and response from that first launch. So I just want to give a testimonial that there are already nursing homes in Connecticut that are seeing the value of this program. So I really encourage our members to participate as well.
Yes, and there are several, you may, as your community may have signed up through either the main landing page through the University of New Mexico or through AHRQ. If you did that, and I have the list of communities here who did that, and I recognize several LeadingAge communities, still do go ahead and sign up on the red cap link that I've sent to you or posted here in this presentation. But I have your name down here and someone will be contacting you in the next few days. So if you remember signing up with interest sometime in your past at either AHRQ or HQuinn or University of New Mexico, then I probably have your name. And I also understand, as it always is in this kind of world when we're trying to get a project jumping off quickly, there's a lot of moving parts. So bear with us because we're all trying to get this going as quickly as possible. And I know probably there are lots of different sign-up sheets coming at you about this same project. They do all end up at my desk, hopefully. And so I will get you in. And then my email and contact information is there. And that's a number 2. That looks like a Z, but that's a number 2 to get me personally. So you can also follow up with any questions.
Thanks so much, Annie, for being here. Dana, I turn it over to you.
Thank you, Melissa. Thank you so much, Annie, for all that information. We are going to move into our panel discussion now regarding how members are handling the Thanksgiving holiday. And we're very fortunate to have Carrie Davis, Administrator of Covenant Woods, Brian Patterson, Chef at Goodwin House, and Dr. Jim Wright, Medical Director of Our Lady of Hope. He's going to be joining our call at 11:30, but we'd like to go ahead and kick off with you, Carrie. So over to you. Thanks so much.
Thank you, Dana, and good morning, everybody. I appreciate being able to share today something that we've come up with. It works for us on our campus, and if it gives anybody else ideas, we're happy to share. And I'm also happy to hear what ideas others have as well. To start off, I just wanted to let you all know that we are currently doing outside visits. Our in-person visits are scheduled for outside as well as doing the GUGO Dual calls. And our outside area right now, we've tried to accommodate all the different seasons, so it's semi-enclosed. We have heating and cooling available, but we know at some point in time that may not be sufficient. So we are looking at the possibility of bringing in that particular model for inside visits and are kind of leaning towards that now as a general inside versus in-room visits, except for compassionate care. We have always continued during this entire time to have in-room compassionate care, as I know many of us on the call have. We found that the thing that we had to change the most was just limiting the number of individuals in the room for visitation at one time. And then, of course, providing the additional PPE. Um, Other than that, for compassionate care, our processes have been able to maintain pretty much the same. That being said, we knew Thanksgiving was coming up, and on our campus, looking at our population and the families, and certainly that desire to be together that all of us have, we recognize that a number of family members are not capable of taking the residents off campus. There's been transportation issues for the family, not being sure if they can handle the needs of the resident, wanting to go home, but the home not being set up appropriately. I can tell you that from an infection control standpoint, we were also a little bit hesitant. What does that mean if families do manage to go home? And knowing that if someone did go home for Thanksgiving, that per our current protocol, they would be on 14-day isolation. So we wanted to come up with a way to kind of work with both of those. And what we came up with was offering a Thanksgiving meal. We've managed to have offerings to provide each resident in all of our levels of care, healthcare, assisted living, including our memory support, the opportunity for a full Thanksgiving meal with up to 3 guests. And we are doing that for the memory support residents on their actual unit, and they will be eating in a private dining room environment. And then for our assisted living and healthcare residents, we're fortunate enough to have a multi-purpose space that can be rearranged as a restaurant. And we will have basically 2 mini restaurants, one with 4 tables and one with 3 tables. Direct access to the outside for the guests to come in once they're screened. So minimizing the guests that might be coming through the building, but also offering that opportunity for the one-to-one. So we've scheduled actually multiple opportunities over a 3-day period, the week of Thanksgiving, around the lunch and dinner hours. Right now, we just opened up reservations last week, and before the end of the week, we were at 60% occupancy. So we're really excited about that. And with all of these programs, and one of the things that we've done is worked with our local health department just to kind of throw ideas towards them as to things that we wanted to do or thought that we wanted to do to kind of push the envelope to meet the socialization needs. And we've been fortunate enough to have that relationship where we do get some additional guidance. We do get the opportunity to have them tell us if we need to look at a different option, and to also share what they're familiar with other communities, not just in our area, but nationally. So with being able to have information from LeadingAge and then with our local health department, we've been able to progress our visits at a pace that's really good for our campus and being able to provide the staff support. So I think with that, Dana, that's probably a very high level overview, but we're definitely open to any questions anyone might have.
Thank you so much, Carrie. Dana, are you there? Oh, okay, Carrie, there is a question that came in. What will be the protocol after the meal? Isolation or testing?
Thanks for that question. Actually, hopefully neither. We are going to continue weekly visit tips that we'll send out to the responsible party that is coordinating the guests that are coming in for the visit, and we will do a education program, short education program, infection control related, when the guests come for their screening to come in for the meal. Right now, we are set up to use larger round tables. We will have the residents sitting kind of at one side, which sounds kind of funny to say because it is a round table, but they will be sitting in one location and socially distanced from the guests that they have at their table. We are still going to have, except for during the actual eating or drinking, have everybody wear their masks. So we will have that, constant hand hygiene, etc. If for some reason the guests and or resident breach the protocol that we have in place. If they end up doing, the hugging and the kissing and the things that we're like, no, please don't do that, then we will have to look at possible isolation for the resident. But if the guests are maintaining the social distancing, then we will be able to just have the resident return and continue our regular monitoring. This, again, was one of the things that we wanted to try to avoid, having to have the residents on any type of isolation. So it will be socially distanced, it will be monitored. We will have staff present to help not just with activities as needed during the mealtime, but also to monitor for infection control. As a rule, just on a side note, we currently do not require any testing for our guests that are coming onto campus. Thank you for that question.
A couple more questions have come in, Carrie. So one was, I'm not understanding how social distancing plays into the meal. And kind of a follow-up is, during eating, masks are off. At this time, there's talking to each other at the table. How is this infection control breach handled?
Yeah, I appreciate that question as well. We are, I guess, getting to a point where we're trying to allow for a little bit more socialization and the comfort in a comfortable atmosphere. Yes, during mealtime, the residents, the families, they cannot have a mask on and eat. Being able to sit farther across from each other will help minimize that immediate contact. We are, with the screening process, going to go through a whole battery of tests and evaluations, the traditional questions, but also sneezing, coughing, those types of items, particularly paying attention to. And from an air quality standpoint, the rooms that we're using do turn over the air quite frequently. We are doing 30-minute breaks between. We have two seatings for lunch, two seatings for dinner. We're having that 30-minute interval in between where we're doing cleaning, disinfecting, and all of that. It's still a risk. I think everything is a risk at this point, but it's less of a risk from our perspective than if all of the residents were to go home with the families or out into the environment at large, or if we had all of those families actually on the skilled or assisted living units.
Yeah, I mean, nobody has a crystal ball, right? So you're just doing the best you can, and doing as much contingency planning as possible to try and still make this an enjoyable holiday, Carrie. I so appreciate that. The last question we have so far is, will there be a time limitation for the meal social visit?
Great question. We have it set up for 90 minutes. That will include the opportunity for us to provide the meal as well as that socialization for the resident and family. Currently, with our process that we have for the outdoor visits, we have a 15-minute window that we're working off of for those visits in order to accommodate all of the residents with an opportunity. So the 90 minutes should definitely cover the meal and additional socialization. That is our hope. We will take the results of this into consideration, looking at Christmas, which we will have to be planning for actually right after Thanksgiving. But right now, it'll be for Thanksgiving specific, it'll be a 90-minute opportunity.
And then another question just came in, Carrie. What are the plans for independent living, or is this across the campus?
Wonderful question as well. One that we struggle with a lot, as most of you may also struggle, having multiple levels of care on the same campus. Our independent living does not fall under the same rules and restrictions. We do not implement the same rules and restrictions in independent living, particularly at this time. What we are doing in independent living is offering a meal for Thanksgiving. We actually put out a survey to the residents, trying to get an idea of how many would be going off campus versus how many were going to be eating on campus and or would want to have the meal catered or be able to do a pickup so they could have family come and stay with them, because we have limited seating for guests in our independent living right now. We currently do still have a large number of residents in independent living that will be going out with family. We'll continue to encourage them just as they go out on a daily basis to monitor for signs and symptoms upon return. But we are also offering one dining venue that will be open for anyone to come down for the holiday meal. And we will be offering delivery for a pre-purchased Thanksgiving meal should residents decide in independent living to have family come and dine with them in their residence.
Fantastic, Carrie. Thank you so much for being willing to share what your plans are. And I know if any more questions come on, I hope that you'll be here to answer them. But I just really appreciate you sharing your perspective. So thank you.
Well, certainly. Thank you.
And Brian Patterson with Goodwin House, are you here and able to share what your plans are for the upcoming holiday?
Yes, good morning. Can you hear me okay?
Sure can, Brian. Thanks.
All right. I'm very proud to represent the entire Goodwin House team. And we have collaborated for a Thanksgiving plan. And keeping in mind that if absolute safety is total isolation, then we are indeed nudging the needle to provide the safest possible environment to ensure a comfortable communal gathering experience. We are at both houses of Goodwin House offering to our independent living residents a Thanksgiving banquet featuring full table service, including china, silverware, and stemware in a seasonally decorated dining room. There will be two seatings, the first from 11:30 to 1 and the second from 1:30 to 3. The first reservation will begin at 11:30 with parties staggered after that. Attendance will be by reservation with 2 to 4 people at a table, and that's how we'll handle our social distancing, with a maximum of 40 people per seating. And we also are entertaining the idea of live instrumental music, not singing and not instruments played by breath, but stringed instruments. And we're even asking that the musician be willing to be tested 7 days prior. Regarding the small print, what I call the small print of our execution of this scenario, guests will be screened on the way in to the dining room. Dining room service staff will be tested Monday prior to Thanksgiving, and all service staff will have in-service training for hand washing and PPE protocols, including face shields and face masks. Service staff will consist of a supervisor, 3 servers, and 2 bussers, and those bussers are dedicated to bussing. That is to say, we're not going to have the same staff who are serving act as bussers. There will be serving staff dedicated and bussers dedicated, and keeping those two separate. All service staff will wash their hands between serving each party, and bussers will change their gloves and wash hands between clearing each table. So we're really maximizing our safety protocols for a communal dining event. Table service staff will be kept apart from food handlers and utility staff, just to further sort of save the bubbles. And the dining area will be cleared between seatings at 1 o'clock so the tables and chairs can be cleaned and sanitized for the next service. And we also will have a regular schedule of sanitizing frequently touched surfaces and chairs and tables. For those who opt not to come to the banquet, we will continue, room service will continue in force for free for those who choose to stay in their apartments. And those meals will be delivered in an upscale. We're going to kind of upscale our delivery on Thanksgiving with a seasonally themed bag, a reusable bag with a holiday message from administration and leadership included in that meal bag. So we're going to have a little bit of a personal touch from leadership and administration to reach out and share a familiar voice. We will also be offering holiday meals to go, consisting of the same items that are on the menu. And it will be available to residents as well as staff as takeaway or to eat in. And we're considering also a holiday pie program. We are also allowing independent living residents to leave the community to dine with their families. So we're not inviting families into Goodwin House, but we are allowing independent living residents to leave the community for the day to dine with family in the immediate area. Residents who choose to leave campus will be provided with recently issued CDC guidelines. I think most of you saw CDC put out a very nice piece on advisories for the holidays. And we will remind residents who are going off campus of those protocols, namely stick to small family groups, avoid traveling, avoid crowds, avoid shopping, and always self-monitor. After a resident goes out for the day to dine with their family, upon their return to campus, they will stay in their apartments as much as possible, wear surgical masks if they leave their apartment to pick up their mail and packages or come down to common areas, not attend any gathering or groups, avoid common areas if they do leave their apartment, and please don't go to the clinic for services, but rather call the clinic and be provided a reminder list of COVID symptoms to monitor for. And also report any temperature, erratic fluctuations. If a resident stays overnight away from the community, they will be on quarantine when they return to campus. And all residents in Goodwin House will be tested the week following Thanksgiving, just for that extra measure of safety and security. And we have a motto that with safety comes comfort. So we are providing as safe a protocol as possible to make this a comfortable occasion. Thanksgiving in skilled nursing, assisted living, and memory care, spouses or up to 2 family members that live on campus may dine with their relatives who are in the health care center, assisted living, or memory support. Our life enrichment programs at both houses have a robust program for Thanksgiving. Really cool, I think. Both houses will feature a living tree of gratitude, which will be a live plant, ideally a tree. And from November 19th to the 26th, residents will write what they are thankful for on a fall leaf ornament and hang those on the tree. And then the grounds departments at each campus will plant those trees. Both houses will broadcast a virtual concert, and particularly at Alexandria, they will host a Thanksgiving holiday walk. And at Bailey's Crossroads campus, we will be giving away herb grow kits to sort of bring a little life force into residents' apartments. Thanksgiving in the healthcare center, the therapeutic recreational supervisor will conduct morning exercise and Thanksgiving bingo. Healthcare residents will receive Thanksgiving gift baskets containing small bottles of sparkling apple cider, crackers, and cheese, and small prepackaged fruit. And a Thanksgiving themed movie will be shown. So that's what our plan is for Goodwin House. And speaking as chef, and it's an interesting title, Chef of Innovation and Development. So I'm very proud to represent not only the dining services and the life enrichment programs, but the entire Goodwin House team at large. And I'm happy to take your questions.
Wow, Brian, thank you so much for sharing what sounds like is going to be a really special holiday. You guys are pulling out all the stops. I just saw somebody commented privately to me that they would like to come to Goodwin House for Thanksgiving. Um, and I would like to know if you would deliver your Thanksgiving dinner to my house so I don't have to cook. Um,
I am a full service chef.
Well, thank you so much. No questions have come in yet, but if you'll just hang on with us in case some do, we would really appreciate it. And thank you again for sharing with us this morning.
My great pleasure. Thank you.
Dr. Jim Wright, are you on with us?
I'm here, Melissa.
Good morning. Good morning.
Good morning. Good morning.
I have to tell you, I feel like I could pick your voice out of a voice lineup with all the calls that we are on together. And
Yep. And I'm always saying something. So yeah.
no, look forward to the day where we can meet in person. But thank you for joining us tomorrow. And I'll hand it over to you.
Great. Well, I don't have a whole lot to add. What I would say is, first of all, I'm astounded by the thought and the care that's gone into these Thanksgiving plans in Covenant Woods and the Goodwin House. I am medical director of 3 facilities, and we're all struggling with that balance, like Brian was saying, that balance between no risk at all, as if we can imagine a situation with no risk, and compassion. And I have been in conversation with owners and operators of these facilities, some of which who err or lean towards the side of risk reduction, perhaps a little bit too much, and some who are balancing it as best as they can. And it is it's a unique position that we're all in. I think all of society is in this unique position where we seem, at least the operators, the DONs, and the administrators, as well as medical directors, we seem to be in this position where we're the arbiters of this balance between risk and compassion. And it's something we're having to learn at the same time as we also learn how to deal with acute illness and respiratory issues and even deaths from coronavirus. And so it's a chaotic period, and I'm amazed at the thought and the care that Carrie and Brian have put into their Thanksgiving meals. And I would say, from my perspective, despite having lived through one of the worst coronavirus epidemics in the state, the outbreak we had at Canterbury, I think still leads the state in deaths and death rate. Surprisingly, I am in the group that feels strongly that there is no such thing as a no risk situation. And we really have to become better at balancing the obvious risks of infection with coronavirus with the not so obvious risk of isolation. And some of my colleagues in my national group, AMDA, have called this what we're dealing with as the isolation pandemic. So I am definitely seeing health health risks and real effects from isolation. And I know everyone on this call has seen that as well. And it's at first in a situation like coronavirus where you're just scrambling to keep people alive. The decision tree is pretty limited. You just want to keep people safe from coronavirus. But now that we're 8 to 9 months into the crisis, we realize there are other things we need to keep our residents safe from as well, and that includes the effects of families not being there to help residents with their daily meals, to more difficult to appreciate risks, including families simply processing for their loved ones who have cognitive issues, just processing the world to help them understand and anchor themselves to something. I've got a lot of patients with dementia who have simply been cast adrift from any anchors that they had to their past, to their family, to reality, and they're lost and they're floundering. And you can tell that. You can tell that as you look at them. I can tell that as I examine them, as I look at their weight loss, as I look at their increasing level of depression and withdrawal from the community. So I think now that we're 8 to 9 months into this crisis, we all have a much better appreciation for the other risks of this isolation pandemic. So having said that, I applaud every single person's interest and efforts and imagination in making this holiday season a good combination of safe and joyful. For some residents, I think this will be a family reunion that could very well be a lifesaver. And I really urge everyone on this call to follow the lead of Covenant Woods and Goodwin House to find that balance. And I'm available as well for any questions or concerns, and would be happy to speak from my experience.
Thank you so much, Dr. Wright. And I know everybody on this call joins me in just applauding you for what you've had to go through and how you've supported the communities that you're involved with. So we can't imagine what the journey has been like, but appreciate your willingness to be here with us, and really appreciate the comments about the social isolation. When people ask me what do LeadingAge Virginia members do, I say they create community, and that
Exactly.
is one of their major roles, and that has been diminished because of this pandemic. And so I think the fact that we are now at this intersection between keeping people safe and helping them enjoy the later years of their lives the best they can is really, really critical. So I know we all appreciate your comments.
Oh, thank you, Melissa.
Thank you. Thank you. I don't see any questions in the chat box. I see lots of thumbs up that are kind of affirming what Dr. Wright said about Covenant Woods and Goodwin House. So again, thank you, Brian and Carrie as well. We have about 14 minutes left, so I want to move over to our dear friend and colleague, Janine Fink-Boyle from LeadingAge National, to see, Janine, anything late and great we should know about?
Yes. Can you hear me clearly, Melissa?
Sure can. Thank you.
Great. So I just wanted to share, I thought that it was wonderful to be able to hear the Project Echo presentation. And just, I want to kind of give a little bit of a push for all of you to sign up. I was just added to the IHI faculty. So I started teaching yesterday in a cohort for a few states, which is through IHI. So it's not in the Virginia cohorts, but I think it's a great program. I know it is 16 weeks. It takes an hour and a half of your time. And as Annie said, that you need to be part of 13 weeks, but the content, the ability to collaborate and share with other nursing homes, throughout your state, and working with the faculty, I think is a great opportunity for all of you. And and obviously, at the end there are dollars that will be given to your organization. So I just wanted to kind of just give that information, and just for all of you to know that through LeadingAge, I am part of the faculty that's working on that project. Yeah. And then one other piece, if I could just have just one more minute, is that okay, Melissa?
You have 13 minutes if you want them.
Okay. Sure, great. So it just came out, I think I think it was later last night, but I know that there is not a vaccine yet. However, with the partnership with Walgreens and CVS, the sign-up process was to end in a 2-week period that would be Friday, October 30th. And that has been extended. And it's been extended through the first week of November. And in front of me, I think it's November 6th. I'll pull that up. Not November 9th. I think it's November 6th. So just really, if you have not signed up as a nursing home or as an assisted living, nursing homes, remember you sign up through the NHSN. And if you're an assisted living, you're going to sign up through the Red Cap system. I know that that those 2 links have been out there, and we can make sure that you have them, but you do have a little bit more time to sign up. What will happen after, we don't know. Obviously there's lots of chatter that's been going on. There's lots of distribution of information, but since there's not a vaccine, we don't know how the process will work. What I do want to say, just because I know that we've been working throughout our membership and with our state partners, is that if there is a Walgreens or a CVS that's over 75 miles from your organization, that they're not going to use anything above 75 miles. And I know that, that really affects some members in more rural or frontier states, but just to know that you do have the ability to sign up for either Walgreens or CVS, but if you're working with your local pharmacy or your long-term care pharmacy, that they still have a process that they have to complete. So we've been really talking to members about this is an opportunity now. We don't know what the process will be, so you don't want to lose that opportunity for signing up. And at the end, they're not just going to show up at your doorstep just because you said yes. There'll be a process, and if that pharmacy that you're working with locally or your long-term care pharmacy hits all the pieces that they need to, and a lot of it, obviously has to do with the cold chain storage and the ability to do that, you should be able to pull back. And I think that I saw Dana said Life Care CCRC. You can sign up on the Red Cap system. We understand that the wording is using congregate settings, so that the LPC or if you're calling still CCRC. And thanks, Dana, just put that in there. And then the other big announcement that came out that I know that Jody has been talking about on our calls for the last few weeks is the point of care antigen testing requirements that are now in the NHSN. I know that we've had links to Unfortunately, there's not a dated new memo from CMS or CDC or the Health and Human Services, but it is the memo that is dated June 4th, or it is the documentation that's dated June 4th. In there's been the change, and it's not a change, but an addition about the requirement for reporting on NHSN for nursing homes of POC. Testing. So I think Jody's going to touch on that again on our call today. And hopefully if you have the ability to be on our 3:30 call today, you'll hear a previous surveyor from the state of Nebraska that's now an administrator in an organization. And most of the call will also focus a little bit more information about what we know with vaccines and some more information, provider relief about infection control funds. So I think that's everything that I had, unless there's any other questions.
Wow, Janine, I don't know how you fit in this Project Echo facilitation with everything else that you do. I'm really convinced that you don't sleep.
I don't. That's okay. I have 2 kids that I try to get to bed That
I'm in awe of you as well as all of
Thank
our
you.
members and how hard you all work. And so we appreciate you being here with us, Janine.
No
Thank
problem.
you so much for that.
Welcome.
I just want to give one last shout out. Anybody have any other questions? You can unmute yourself if you have any comments on what your plans are for this Thanksgiving that you think would benefit the group, or if anybody has already signed up for Project Echo and you just kind of want to give a little testimonial to why. Would love to hear from you. So I'll give it a minute to see if anybody unmutes. All right. Well, hearing no one, Dana just put in the link to register for the LeadingAge National Call at 3:30 today. If you aren't already registered, I want to say thank you to all of our guest speakers today. The sharing that happens through the association is just such a huge benefit, and we appreciate learning from you. So wishing you all a great rest of your week. And as always, if there's anything you need at all, your LeadingAge Virginia team is here for you. So don't hesitate to reach out. Thank you for your membership and take care.